for research in family health at the IWK Health Centre in Halifax. She brings with her 21 years of pediatric nursing experience and spent the last 18 years conducting research, specifically randomized controlled trials. For 9 of these years, her research experience was focused in the field of pediatric infectious diseases and vaccinology at the Clinical Trials Research Centre at the IWK Health Centre. Past 9 years have been in psychological research, specifically distance delivery of cognitive behavioral programs using technology. Her research interests are in distance delivery systems, distance therapeutic alliance, and how the treatment setting can influence the level of therapeutic alliance, self-disclosure, and a person's perception of obstacles to treatment. She's published a number of articles, abstracts, and editorials, and we're very fortunate to have her here, and I have anticipation of a very exciting and informative presentation. Thank you.
Thank you for inviting me to speak today, and thank you all for coming. I'm going to introduce a telehealth model of health service delivery called the Family Health Program to you today, and present some results of how we've been able to increase access to mental health services in rural areas of Nova Scotia. So first we'll look at some of the prevalence of pediatric mental health issues, introduce the Family Health Program, and I'll present some of our outcome results to you as well. So you think about many parents who, on a daily basis, deal with these types of behavioral problems day in, day out, month after month, and sometimes year after year. We know that pediatric mental health problems like behavior difficulties and anxiety can really wear down a parent. It can affect that individual child as well as society in general if these problems go untreated. These are very common problems. The Ontario Health Study that was conducted by Dan Offord and colleagues found that approximately 18% of the pediatric population actually had a diagnosable mental health disorder. We also know that untreated mental health disorders become much more severe over time and much more difficult to treat. We also know that you can have one mental health disorder that goes untreated and it can lead to other comorbid conditions. For instance, it's not unusual to have a child who is older with ADHD or disruptive behavior disorder and also have a comorbid anxiety disorder as well. Additionally, these untreated problems will track through their childhood, their adolescenthood, and even into adulthood if it's untreated. So the Ontario Health Study also showed that although it's a very prevalent problem, only about 16% receive services, and it's still an issue in Canada today. Canada-wide, we have access issues, and a lot of these access issues are around the fact that there are a limited number of specialists. So therefore, the mild and moderate cases often wait fairly long periods of time to receive services, and in that time, problems become exacerbated and much worse, and the cycle continues. There's also a scarcity of primary care-focused pediatric mental health intervention programs, and more importantly is the barriers that families often meet. Daytime appointments, having to take time off work, the resistance of taking children out of school on a weekly basis for a 12 to 14 or 16-week program. There's a travel burden for those who live far away from the tertiary care centers, or even those who are in the metropolis who don't have access to transportation, relying on public transportation. Instead of a single parent, we often have parents in Halifax who say, I live in the outskirts, I have to take 3 buses to get to the tertiary care center. I'm a single mom, I've got 3 children. I have to drag my stroller onto the bus, and sometimes over time, it becomes so frustrating for them they give up. So that can lead to high attrition rates. There's also a financial burden that goes along with the travel. And of course, there's the stigma that's attached to receiving services. So family health was designed with these access issues also send along skill demonstration videos so that the parents and the children can watch these videos time and time again to really get to know how to learn these life skills and strategies and practice them in their activities of daily living. Thirdly is your telephone coach. This is probably one of the most important components. The telephone coach will provide weekly telephone support. They work days, evenings, weekends at the convenience of the family. And again, treatment is all skill focused. So our treatment programs target specific problem areas. It's a self-help design, and it's focused on learning one new skill a week. And most of our programs are approximately 12 weeks. And that's very much dependent on the capacity of the individual. So the parent and or the child will review the material in the handbook. They'll complete some of the exercises that are in there. And most importantly, they practice the implementation of that new skill. And they practice it daily and they practice it often. So we try to see all of these problems that they present with through the resolution. That's our goal. So the telephone coaches, let's take some time to talk about them. They're non-professionals. They perform protocolized telephone treatment sessions, so we don't have to worry about a whole lot of variability between coaches because the skills they're following are the same skills that the parents learn at home. So they don't deviate from that. They focus entirely on what the skills are in the program. Each week, they have their caseload reviewed by a very experienced coach supervisor, and then somebody like myself, who's a licensed healthcare professional. I supervise all of them, and I'm on call 24/7 for any questions. So when we hire coaches, we hire and we interview, and we look for people who are bright, capable, and personable individuals. They go through a bit of competency testing with us, and they have to demonstrate excellent interpersonal communication skills. All of our calls in family health are digitally recorded so that I can monitor for quality assurance purposes to make sure that there's no deviation from the protocol. The coaches, we always have a coach on call, and we have 24/7 access toll-free to our clients, so if they have any difficulties or they're running into problems at home and they really feel they need to speak to our staff urgently, they can access us through that 24/7 toll. We have strict risk management, and again,